Hi, I have been studying misinformation for nearly 20 years. And when the COVID pandemic came along, I wasn't at all surprised by the accompanying infodemic. However, what did surprise me was how much of that infodemic of misinformation was related to climate change and climate change denial. Now, with climate change, we know that there is a 97% scientific consensus on the basic facts of climate change. And political operatives who are opposing the scientific consensus for political reasons are trying to undermine that through things such as fake petitions. Now, with COVID, there is a lot more scientific uncertainty than in climate change. But nonetheless, there are things that we know about COVID, and there is a scientific consensus about aspects of COVID. So what does the COVID counter movement do? The people who are suggesting that we don't know anything about the pandemic? Well, as it happens, it is the same political operatives and so-called think tanks that have created fake petitions to deny climate change that are now also creating a lot of confusion about COVID. So, for example, a recent petition allegedly by scientists who are opposing the role of social distancing in controlling COVID is an exact parallel of similar fake petitions that we have seen with climate change. Now, to avoid being misled, you have to look out for those bad arguments. And that is the purpose of this video, to tell you more about those bad arguments.
Hi, I'm Marie-Jean Schick, and I'm a psychologist conducting research on the way people make decisions and adopt specific beliefs. We are now in November 2020, and since the onset of the pandemic back in February, we've seen the rise of many new conspiracy theories explaining the origin of the virus. For example, the belief that it was bioengineered by China, or the belief that it's caused by the 5G network more recently. Those conspiracy theories do not deny the existence of the virus. On the contrary, they recognize it as a threat from which they have to protect themselves. So today I want to talk briefly about those beliefs and how they relate to health behaviors. So people who tend to believe in those conspiracy theories, they are equally likely to wash their hands and social distance, but they are reluctant to take some other health protective measures, such as being tested if they have a fever or being vaccinated. Why is it, and how can we avoid this? First, we have to scrap the idea that conspiracy believers are risk takers, like it's commonly portrayed in the media. They are not. They have a different perception of the risks and benefits of different behaviors, like being tested or being vaccinated. And so, for example, they believe being tested or being vaccinated is risky. They see it as a threat for themselves. So it's rational to stay away from those behaviors. Conspiracy theory believers are more likely to be victims of misinformation about testing and vaccination because they tend not to trust the government or the medical community to provide accurate information. So what I want to stress in this brief video is that we all want what is good for our health and our well-being, even people who believe in conspiracy theories. So to ensure that we all benefit from medical progress and create a safe environment for all, we have to work to provide correct and trustworthy information to all, especially those who are extra worried and vulnerable to misinformation.
To avoid being misled, look out for bad arguments.
We like to see ourselves as critical thinkers, considering all the available information before coming to a rational conclusion. The problem is, most of the time we're the opposite. We start with our beliefs, then try to find evidence to prove to ourselves that we were right. This can end up in wishful thinking, believing something is true because we really want it to be true. People downplaying the COVID-19 pandemic have made a range of COVID predictions based on wishful thinking rather than scientific research.
You know, in theory, when it gets a little warmer, it miraculously goes away. I hope that's true.
I think you'll see by June a lot of the country should be back to normal, and the hope is that by July, the country's really rocking again.
After November 3rd, coronavirus will magically all of a sudden go away and disappear.
We're rounding the turn. We're rounding that turn.
Epidemiological models take into account a number of factors: how infectious the virus is, mortality rates, the impact of different behaviours like social distancing, and they're constantly being updated with the latest data as our scientific understanding increases. In contrast, wishful thinking substitutes data and science with feelings. This can have dire consequences. Wishing that COVID would just go away delayed desperately needed measures like social distancing. A study from Columbia University estimated that if the US had started social distancing just 2 weeks earlier, it would have prevented over 50,000 COVID deaths just by May. It's easy to fall for the fallacy of wishful thinking, so how do we avoid it? A scientific approach considers the evidence first, then comes to a conclusion. Science deniers make up their mind first based on what they want to believe, then deny any science that conflicts with their beliefs. When we hear people make claims, are their claims based on science and evidence or on wishful thinking? Following the evidence rather than feelings is the key to avoiding being misled by wishful thinking.
Reducing the complexity of issues like climate change or the COVID-19 pandemic by claiming that there are only two perspectives on these issues. For example, either you choose freedom or you choose to wear a mask, is simple black and white thinking. Science deniers use the so-called false dichotomy to make scientists look like the bad guys. Be careful if someone advocates simple solutions for very complex issues.
Herd immunity happens when enough of the population become immune to a particular virus, reducing the risk of spread and offering protection to those who aren't immune. It's a concept typically associated with vaccination programs. A concerning and false narrative assumes that if we allow COVID-19 to spread amongst the population, we can develop a natural immunity to the virus. This is not the case. There is currently no evidence to suggest that those who have been fortunate enough to recover from COVID-19 and have developed antibodies are protected from a second infection. In fact, the number of cases and death tolls have continued to surge in countries which have been ineffective at implementing measures like social distancing. Herd immunity is also unlikely to fully eradicate the virus. Populations can still be susceptible to outbreaks, particularly if immunity isn't long-lasting. Letting the virus run its course is therefore not a strategy to tackle COVID-19 and puts more people at risk of harm. While lockdowns and social distancing are understandably frustrating, they're the best methods we have at our disposal to slow the spread until an effective vaccine is released.
I want to highlight some misinformation on COVID-19 that I've encountered a lot out there, and it's that COVID has a very high survival rate. The numbers I've seen vary. Some say 98.4% or 99.7% or even 99.997%. In part, this variation may be due to people looking at different age brackets, but basically this is a misleading claim aiming to make you believe that the virus is harmless. Well, it's not. First of all, the numbers are made up. No one knows what the true survival rate is because it's just too early to tell. Even if we assume that it's 99%, that's still 10 times more lethal than the flu. As we're tracking towards 100 million cases globally, it still means 1 million people will be dead. And if we accept the narrative that the virus is harmless and we should just go back to normal, those numbers would quickly grow even larger. And that is not even taking into account that so many cases will overwhelm the healthcare systems, and many additional people will suffer or die due to heart attacks, cancers, traffic accidents, and so on, because there will simply not be enough resources for all. Second, just because you survive doesn't mean that your friend's mother will survive if you pass it on to your friend and they pass it on and so on. Finally, the survival rate ignores the potential for long-term symptoms and complications, what doctors are now starting to call the post-COVID syndrome. So don't be fooled by seemingly convincing numbers that are just meant to trick you.
Many claims and alleged explanations underlying COVID or climate change denial are incoherent or inconsistent. You can think of these terms as synonyms of contradictory or mutually exclusive. For example, claiming that temperature cannot be measured accurately and that global temperatures have declined is incoherent and inconsistent. It's either or. In fact, denialists often use the alleged lack of coherence to attack explanations they view as false. For example, they might deny that COVID is real, claiming that this is not consistent with the alleged fact that so many other crises have been staged. However, incoherence and inconsistency are often traits of conspiracy theories themselves. With respect to COVID-19, for example, claiming that it is not real and claiming that it was engineered in a lab is incoherent. It's either or, cannot be true at the same time. A strategy of conspiracy theorists is to change the theory bit by bit when threatening information or questions are brought forward. They try to modify the theory in a way as to defend it against attack. This almost involuntarily leads to incoherence. First claiming that COVID-19 is not real, and then, in reaction to counter-argumentation, suddenly switching to claiming that it was developed in a lab is inconsistent. Not every incoherent or inconsistent theory is necessarily a hoax or a conspiracy theory. However, watching out for inconsistent patterns in explanations, especially if these patterns are used to defend against critical remarks or questions, is very important to spot conspiracy theories and wrong claims.
I want to highlight a misrepresentation that I've seen a lot on social media. It's the claim that the models are wrong. They predicted 2 million deaths by the end of the year, but we've only seen 1.3 million deaths so far. Now, first of all, 1.3 million is of course bad enough. A really bad flu season only leads to about 50 to 60,000 deaths globally. But still, the claim that the models are wrong is used to try to make us believe that COVID isn't so bad and to discredit the modeling. Now, what this claim overlooks is that models are not intended to predict predetermined realities. That's just not what they do. Instead, what models are meant to do is simulate potential realities based on particular assumptions. So if a model predicts this will be bad unless we do something about it, then typically we do something about it, right? For example, change our behavior. Now, if we change our behavior, so we have lockdowns, socially distance, and so on, the outcomes will change in response. That basically means that model predictions can be accurate, but not come true. This is known as the prophet's dilemma. It's related to the so-called Y2K fallacy, where if a bad outcome does not eventuate, people take it as evidence that there was nothing to worry about and that we overreacted. But saying not many people got sick, so there was no need for a lockdown, is like surviving a head-on car crash and then claiming you wouldn't have needed the airbag and the seatbelt in the first place. So in other words, models are actually super useful.
One way in which someone might try to persuade you of a particular position is by using an analogy. For example, we don't shut down roads to prevent traffic accidents, so why should we close shops and workplaces to prevent COVID? These kinds of analogies can be very persuasive. They have an intuitive appeal and at first glance often seem to make a lot of sense. It's absolutely true that we don't shut down roads to prevent traffic accidents. We're quite prepared to tolerate a certain number of deaths for all the advantages that road travel brings. However, when you come across an analogy, the important thing to ask yourself is whether it's a good analogy. Whilst it's true that both roads and COVID kill, there are important differences between the two that make this particular analogy a bad analogy. The key difference here is that traffic accidents are not infectious. They tend to occur at a relatively steady rate, a rate at which our hospitals can usually cope with. COVID, on the other hand, is an infectious disease. The numbers of people getting very sick and dying will rise exponentially if we don't try to prevent its spread. This could overwhelm hospitals and result in a much larger number of deaths compared to traffic accidents. So, the next time you come across an analogy, ask yourself whether it's a good analogy or whether there might be important differences between the two things that are being compared.
Be careful when you hear stories or anecdotes about COVID-19. Stories can be very powerful in shaping people's beliefs and attitudes because they tap into emotional aspects, be it in a positive or in a negative way. And it's easy to relate to them. They are easy in their structure, they are memorable, they are the usual way that we use to get to know the world around us. If you think also in our evolution, it makes sense. But there are two main issues with these stories. The first one is that we give them an uneven weight relative to statistics. We are often unable to give them the right weight, especially when they are extremely rare, such as winning the lottery, but also a vaccine severe adverse reaction. And the second problem is that there is often a causal link. So if my uncle tells me that wearing an amulet works because he has not caught COVID since he wears it, is it really a proof? Is it a causal link? Be aware about the persuasiveness of stories and don't be fooled by them.